Hi, I'm Dr Terence Lim and I'm a urologist. I get asked this quite often. To me, urology seems to be the perfect balance in a lot of aspects. It's not just about operating on patients. It's actually specialized enough to go deeply into the subject, yet broad enough to sustain my interest. There's more than one way to do our surgeries, ranging from open surgeries to endoscopic surgeries or even robotic surgeries. I see the robot as mainly as a surgical tool. As surgeons, we choose the most appropriate tools for the best surgical outcomes for our patients. For open surgery, the main benefit is having the surgeon's hand in the body, and this offers excellent manual dexterity in instrument handling, but this is at the expense of a large surgical incision. On the other hand, what we call a keyhole surgery is a minimally invasive approach. The main limitations of it is a limited dexterity of instrument handling as well as a 2D vision. So the robotic approach can be taught to as a combination of the best of both worlds. It allows for a magnified 3D visualization of the operative field as well as the manual dexterity of having the hand inside via a small surgical room. Well, I'm trained as an adult urologist, so I can essentially see anybody above the age of 18 years old. However, I had performed simple surgical procedures like circumcisions in kids as young as 7 years old. I guess it has to be the training to become a urologist. After graduation from medical school, I have to complete 3 years of what we call a basic surgical training and 4 years of advanced surgical training in urology. After that, I have to undergo 1 year of overseas fellowship training specifically in robotic surgery. That's about 14 years of formal training altogether. I think I can be considered relatively lucky in my career. My greatest milestone achieved was when I was appointed the Chief of Urology at the age of 42 years old, considered fairly young to be a head of department of a surgical department. The most rewarding aspect of being a urologist is when my patients are cured of their cancers. I always feel fortunate and privileged to have played a part in their recovery. I spend time with my wife and family during the weekends. I also enjoy playing computer games whenever I have time. This is a hobby which I have developed and continue since I was 10 years old. I also try to run at least 3 times a week. Well, it has to be my wife, my family and friends. I live by a quote by Ben Carson, a neurosurgeon from America. He says that we get out of life what we put in. The way we treat others is the way we ourselves get treated. I believe in treating my patients the way I would want myself or my family to be treated if we were the patient.